Good evening, everyone. Happy Mental Awareness Month. We're still on the mental awareness for October. Today, I just decided to do a short clip on anxiety disorders. Basically, what is anxiety? So, anxiety is that feeling of being fearful. It's a feeling, a panicky type of a feeling. You have intense emotions, and this anxiety or fear or worry affects your daily life. It affects your life at work or school. It affects your activities, even at work, at home, and in all social circles that you go to. So we ask ourselves, what causes anxiety disorders? So anxiety disorders are also caused, they can be genetic, firstly, meaning that they occur in the family. Secondly, a chemical imbalance also causes anxiety disorders. Thirdly, drugs and alcohol, they affect anxiety, and as well as traumas. We mentioned traumas. You can have different types of traumas. It can be rape, can be different types of abuse, emotional abuse, physical abuse, sexual abuse, the loss of someone, so those are different types of traumas. So what are the different types of anxiety disorders? Well, we have quite a number. We have generalized anxiety disorders, and then we can have obsessive compulsive disorders. We can have anxiety disorders with a panic attack. And then there are different types. We can also have post-traumatic stress disorder and social phobia or social anxiety disorders. So those are the different categories. When it comes to anxiety with panic attacks, when someone is having a panic attack, they feel like they're going to die. They feel like they can't breathe. Sometimes they present with chest pains, but it's a very uncomfortable feeling. But we have to train when in therapy. People are trained, and they use relaxation techniques so that people understand when you are having a panic attack, it's actually in the mind. You're not going to die. There's nothing physical about it. So and then when it comes to post-traumatic stress disorder, that one, it can happen, like for instance, if you are raped or you've undergone an accident, a very traumatic one. So you start having flashbacks of the incident during the day. Sometimes you'll have nightmares about it. So those are the different types. And then social anxiety, we even have sometimes performance anxiety. So yeah, it's a very, very common condition. So how do we treat anxiety disorders? The treatment that we use, which is prescribed by a GP or a psychiatrist, we call it anxiolytics. We give anxiolytics, and anxiolytics are none other than your antidepressants mostly. So they work the same, they work the same. So sometimes most of the time you'll find that a patient with anxiety disorders is treated with antidepressants and something just to calm the nerves as well. So what other modalities do we use? Psychotherapy. We also use relaxation techniques, as I mentioned, yoga and exercise. With anxiety disorders, like other psychiatric conditions, Rest is very important. Managing stress, good sleep, also regulating your social media, and then generally a good diet and good exercise. Those are the important things that help someone with anxiety. And of course, a good support system. And prayer. We know prayer works for everything. But as I always say, prayer, not just prayer alone, but prayer in combination with the other healthcare professionals, the doctors, the psychiatrists, the psychologists, the social workers, and so forth. Yeah, and there are also support groups for people with anxiety disorders. And you find that some people with anxiety disorders also suffer. They can be depressed. Yeah. So, yeah, that's my short summary. Thank you.